ADD is one of the most misunderstood of all psychiatric disorders. There are very few people that have even a rudimentary knowledge of the condition. Even today, 90 out of 100 psychiatrists will miss the diagnosis. I like to call attention deficit disorder the great chameleon because it can take so many shapes and mimic so many other conditions. Most people view ADD as a school or a career problem disorder. However, I think that because most ADD or ADHD children do so poorly in general, that their self-esteem becomes severely impaired. Their social skills are often impaired as well, and because of this, they are often ostracized by their peers. I believe these problems are much more important than work or school problems per se. One of the most popular arguments against treatment, especially for children with ADD, is the idea that stimulants are addictive, and therefore the belief is that treatment will cause alcohol and drug addiction later in life. The truth is quite different. 85% of all people with untreated ADD will eventually turn to alcohol and drugs because the body will demand treatment of some kind. Alcohol and drugs will mask ADD symptoms for a little while, and therefore their usage becomes self-reinforcing. As a former teacher, I was somewhat familiar with attention deficit disorder for many years, but was still subject to a number of the myths surrounding the disorder. I was also trained as an alcohol and drug counselor and teaching DUI education part-time. As part of my regular presentation, I would talk about the hallucinogens and their effects and then do the same for the stimulants. As part of the stimulant lecture, I spent only 5 minutes talking about Ritalin and attention deficit disorder. Invariably, at the end of that section, 3 or 4 people would come up and tell me that they had been an alcoholic or a methamphetamine addict for years, and that traditional chemical dependence and 12 steps treatment never really worked for them. They then proceeded to tell me that they thought they had attention deficit disorder. Now, my thought was at first that they were seeking legal drugs. This was in a large part due to my experience that methadone, although touted as a way to get off heroin, simply did not work. Instead, the addict would just become addicted to the methadone. However, this happened each time I did a DUI seminar, and I continued to try to figure out if there was another reason other than drug seeking for these people to see themselves as ADD after listening to the symptoms that I listed in my talk. I theorized that if the brain and body did not feel well, it would try to find any means possible to do so. Since many illegal drugs partially take over the neurotransmitter receptor sites, it made sense to me that people who unknowingly have a psychiatric condition would have a greater chance of continuing to abuse substances, because at least there would be short-term benefits. This was years before the phenomenon of self-medicating for psychiatric conditions was commonly known. I talked about it with a friend of mine who was also a psychiatrist and explained my thinking and asked if he was willing to treat these people if testing proved that they really had ADD. He was willing, and over a 15-year period, we had an amazing 95% success rate. Now, what that means is that not only did the client's attention deficit disorder dramatically improve, but they did not increase their dosage of Ritalin or Adderall and stop their alcohol and illicit drug taking. This was totally unheard of in the field. If a client attended AA or NA and also received counseling, there was an 80% success rate at best. If counseling or 12-step treatment was used alone, the success rate was only 60%. Not only did we shatter this rate of success, but proved that the stimulants actually decreased drug abuse rather than increased it. We also proved that some forms of chemical dependence are really misdiagnosed ADD. There are many other disorders that are really ADD in disguise. When a client complains of anxiety, most of the time it is due to a lack of balance of the neurotransmitters. Most often, the basal ganglia areas of the brain are overstimulated. Tranquilizers simply mask the problem with short-term relief. If the accurate diagnosis is anxiety disorder, using GABA or an SSRI antidepressant or the herb St. John's wort should be the treatment of choice. However, many types of anxiety are a secondary symptom of attention deficit disorder. Part of the anxiety is due to the overstimulation of the basal ganglia, but the main cause is the prefrontal cortex is not fully engaged. Because of this brain imbalance, the client becomes anxious and feels out of control. Strangely enough, a stimulant will tend to calm the person down by activating the prefrontal cortex, which is the opposite of what would happen if the person had primary anxiety disorder. It is also common for people with undiagnosed ADD to be labeled with social anxiety. This can be an example of overfocused ADD that will be discussed further when we reach the section that discusses the 6 types of ADD. People with this condition often have trouble tracking other people's conversations, especially in a group setting. This results in poor social skills and overall anxiety around people. The most commonly prescribed medication for social anxiety is an SSRI antidepressant. This will work extremely well for this condition, but if ADD is the underlying problem, this medication will only be partially helpful at best. Undiagnosed attention deficit disorder is also the root cause of many phobias. I have worked with a number of clients who have had phobias about flying or driving on the freeway. When these clients have been treated appropriately for ADD, these fears and phobias often vanish. I believe that the anxiety is often related to the polarity issue, which will be discussed in more detail later. Reverse polarity causes neurological confusion, directional issues, and overall problems with balance. Therefore, an ADD body reacts by being in a constant state of semi-alert. Nature demands homeostasis or balance. When the body perceives something as threatening, the more primitive parts of the brain activate the sympathetic nervous system into alert status. This system pumps adrenaline into the body so that the person can either flee, fight, or freeze. Once the threat is removed, the parasympathetic system calms the body and brings about homeostatic rest. When someone suffers from ADD, their brain and body lose balance, and the body often reacts by staying in a near constant state of hyperalert. In this state, people often overreact to small stimuli that normally would not cause the body's alert system to become activated. Many times, ADD's most prominent symptoms are depression, moodiness, and sadness. These symptoms often result in diagnosing the client with primary depression, when the main component of the distress is really attention deficit disorder. Feelings of depression can occur when the prefrontal cortex, which is the main part of the brain that is affected by ADD, is not working as it should. However, if the limbic system is impaired, as it is in most depressive states, then that part of the brain needs an increase of serotonin. Limbic ADD occurs when both the prefrontal cortex and the limbic system are adversely affected, and is often treated with both a stimulant and an SSRI antidepressant. Other symptoms that often appear as obsessive-compulsive disorder, but are really ADD, involve too much activity in the cingulate system of the brain. When most people think of attention deficit disorder, what comes to mind is the typical stereotype of a young boy who can't sit still, has problems with reading, and can't focus. However, there are many types of ADD, and one of them is the overfocused type. In this type of ADD, as well as having problems with the prefrontal cortex, the cingulate system is overactive. Underactivity in the prefrontal cortex causes a lack of focus, but the overactivity in the cingulate system can cause hyperfocus or obsessive behavior. The cingulate system is the part of the brain that runs right down the middle from the top to the bottom of the brain and helps promote flexibility of action. When this part of the brain is overactive, flexibility is decreased and can cause obsessions, compulsions, anxiety, oppositional behavior, and often anger. If this part of the brain is overactive, but the prefrontal cortex is working well, then the possible diagnosis would be anxiety disorder, obsessive-compulsive disorder, oppositional defiant disorder, or PMS 3 days out of the month. An SSRI antidepressant or a natural serotonin enhancer, such as St. John's wort or mood care, would be used alone. However, with overfocused ADD, either a stimulant or ad care, which may increase activity in the prefrontal cortex, needs to be added to the serotonin enhancer. Anger problems are another symptom not necessarily thought of in connection with attention deficit disorder. Many times clients are identified with intermittent explosive disorder, when in reality the correct diagnosis is attention deficit disorder. Anger symptoms can occur with any type of ADD, but it is most often seen with either ring of fire ADD or temporal ADD. We will explore both of these conditions later. Frequently, people with ADD are misdiagnosed as having learning problems of undetermined origin. I have seen many clients who have been evaluated using a battery of tests by top schools such as Penn State and received this particular diagnosis. This means the individual was suffering from some learning disorders, but the evaluator could not determine the specifics. The diagnosis of ADD is readily apparent to anyone who specializes in this disorder. The diagnosis of impulse control disorder encompasses many problems. This would include most of the addictions, such as gambling and sex. In my experience, these conditions often result from undiagnosed attention deficit disorder. One of the hallmark symptoms of ADD is impulsiveness. As stated previously, it is also very common for people with overfocused ADD to be compulsive and impulse control problems. So overfocused ADD would have both components.